Hello. If you are even thinking of having a dental implant, or you've just had a dental implant, then this video, you must watch this video. It's very short. I'm going to share with you my own personal experience of having dental implants, and I'm going to tell you what the dental surgeon never told me. The dentist never told me. I'm going to tell you. Well, first of all, who am I? Very quickly, my name's Joe Johnson, and I've been treating people with natural remedies for 20 years. Now, about 20 years ago, I did have an accident and I lost my two front teeth. So I went along to my dentist and he said, no problem, we'll put a bridge in. And I've had that for 20 years with no problem. But recently, I had another minor accident, but it meant that the bridge became loose. I went back to the dentist and he said, Mr. Johnson, you're going to have removed the bridge, remove the roots inside your jaw. Then we're going to have to put a bone graft in, because where your teeth used to be, then now the gum's withdrawn. We're going to put a big bone graft in here, and 3 months later we're going to have you a lovely dental implant. I thought, fantastic, that's just what I want. Now, I had gone to see this guy. He was a specialist. He was very expensive, and he was, what, just for this little job here, £7,500. What's that? $10,000. But it was something that I was assured would last me a lifetime. So we agreed on the course of treatment, and I've got all the course of treatment here. Treatment, plan, estimate, everything from the initial appointment till the final appointment. £7,000. So he said, here's a prescription. 1 hour before I see you, I want you to take 3 grams of antibiotics. And I said, well, I'm not keen on taking antibiotics. He said, look, it's really important because I'm going to give you a bone graft in your jaw and I don't want you to get infected. Now, I might be into natural remedies, but I don't want to die of an infection. So I got the prescription and I took the antibiotics 1 hour before I went in his surgery. Now, I went in his surgery and he gave me the anaesthetic and we just had a little bit of small talk. And he said, what are you doing next week? And this was on a Friday. And I said, well, on Tuesday, I'm thinking of going away for a few days, you know. And he looked at me and he said, on Tuesday? What, next week? I said, yeah. He was okay. Now, I didn't notice. I just concentrated on the treatment, but this became, later on, I realized how relevant this was. So the guy, and he was very professional. What he did, he took my teeth, look, he removed the bridge, he removed the root, he then cut the jaw open, and he's put he's put a bone graft all the way across the front. He's then put a dental implant in on this side and a dental implant in on this side, and he's sewn it back up. I'll put these back in so I can talk properly. So he put, I think, nearly 20 stitches across the top to cover the bone graft up. He then gave me a prescription, 500 amoxicillin, I had to take 3 times a day for 7 days, and 400 grams of metronidazole 3 times a day for 7 days. Now, that was it. He said, off you go. Now, hopefully you'll see a picture on the screen of what I look like. So my whole face was swollen up. So I had the job done on the Friday. By Sunday, my whole face was a balloon. But what they never told me, that my gums would be in absolute agony. So to touch, I couldn't even, now look at this. How can you put a denture on top of swollen gums? I was in agony. I couldn't put my dentures in, so I couldn't go out into the street because I'm embarrassed to be seen with no teeth. So then a friend of mine who's also a dentist, I explained the problem to him. I said, I can't go out. I'm in agony. My face is killing me. My gums are so sore. I can't wear the dentures. And he made me one of these things. It's like a gum shield with the missing teeth in. Now watch this. So he took the denture out, which was pressing on my really sore gums, and put this thing in. You see that? From a distance it looks like teeth, and there's nothing touching my gums, or virtually nothing, which was a great improvement. Cost me a few £100, but it was a great improvement. Now this was almost a week later and I still couldn't eat properly. I was dribbling soup down the back. I couldn't even chew bread. Now, I wasn't going to go on like this forever. I told the dentist, I rang the surgeon up. I said, look, I'm in agony. I can't. They've recommended I take ibuprofen. It didn't touch it. I said, look, I'm in a lot more pain than that. Then they recommended I take tramadol, which knocked me out completely. Now, bearing in mind, I was unable to go away. I realise now what he was on about when he gave me that look. I was just lying in bed for a week in agony with sore gums. They said, just rinse your mouth out with an antiseptic mouthwash. He gave me that type. He gave me that type. He then gave me, I went back again. He gave me some of this dental gel. It's the same as the mouthwash. I rubbed it on. It did nothing. I bought myself some of this stuff, some antiseptic, just to try to reduce the pain and the inflammation. I told him I couldn't clean my teeth. My gums were so sore that my teeth were dirty, and the mouthwash makes your teeth go brown. So they said, oh, we'll buy some of this special toothpaste. I was spending money after money after money, and I was having this problem. I couldn't even wear the dentures, as I say, because this is the glue that holds the dentures in. So you put the glue on. You can't stick dentures to inflamed gums. These are the problems you're going to have, unless you follow my advice. It was a nightmare. I couldn't even touch my gums. I couldn't speak properly. Now, I've been selling natural remedies for 20 years. I was very reluctant to take the antibiotics, but I did because I didn't want to die from an infection. So by this time, 7 days later, the antibiotics had gone and I was still unable to even touch my gums. I thought, sod it, I'm going to do what I know works, or at least what... This is a blend of natural antibiotics. This blend, which I came up with 22 years ago, was designed exactly for gum infection, bleeding gums, receding gums, spongy gums, and it stops people from losing the teeth. And I literally did this. Now, bearing in mind, I couldn't touch my gums. Can you see that on the end of my finger? That brown liquid. I rubbed it onto my gums. I put the top back on. And I thought, I don't believe this. Now, I've been helping my clients with this for 20 years, but I've not actually used it, apart from the odd bit of bleeding gums. I've not used this myself for about 15 years. Within 2 minutes, I could feel my gums start to heal. I thought, crap. I literally took it off, put it on again and waited. And an hour later, I knew I was getting better. I put it on at bedtime. In the morning, I couldn't believe it. I could have breakfast for the first time. Within 2 days, I had my dentures back in, no problem. And I'm just waiting now for these gums. Look, these gums, look. They're rock hard and they're receding like they should. The dental implants are in there, and one in there. Everything's healing now as it should. I can eat what I want when I want. I can go on holiday if I want. I can do anything now. My gums are healed. Now, these dental surgeons are experts. They're experts in gum surgery. They're expert in bone grafts. They're expert in dental implants. But they don't have to live the misery that you're going to have to live. So I'm advising you, if you're going to have a dental implant, get the gum doctor first. Get it. You're going to be shocked about how crap you feel, but when you get home, you'll have all the antibiotics, same as I had. Take the antibiotics by all means, but put this stuff on your gums. Please discuss it with your dentist first. I'm not getting involved in the dental surgeon-patient relationship. Discuss everything with your surgeon. But I've been back to my friend, who is a dentist, and showed him. The same guy that made me this, the same guy that made me that, the one he saw, the one who was recommending all of this stuff. And then he saw the results of that. He is now giving this to his patients. So the product's called Gum Doctor. You've seen how easy it is to work. Just put it on your finger and rub it on. That's it. It is amazing. I mean, I knew it was good, but I had no idea how shockingly good it really is. It's that good, and I have no problem saying this. If this doesn't work for you, you can have every single penny of your money back. End of. You've seen the picture of me, how I was after a dental implant. You've seen my healthy gums, rock hard healthy gums. Soon I'm going to have the bridge put in, screwed in, done. Hopefully everything's fine. But one thing I know that's fine are my gums. So you protect your gums. Order the Gum Doctor now, before you have your dental implant, so you're ready for it and you're not waiting for it in the post. Okay, I look forward to getting it off to you as soon as possible. Bye for now.